In all of our countries, we're struggling on how to get more value and all the cost constraints and some of the quality problems and so on. Let me just say 5 things at the beginning that I will try in the time we have to say a little bit more about. And the first is the importance of focus. Focusing on those populations that have the most critical need for integrated care. In our own country, we have about 5% of our population that accounts for about 50% of the expenditures. And they have a lot of comorbid illnesses, multiple comorbidities, and so on. The second thing I will say, and you know this, but how to bring it about, is the alignment of financial incentives with your capabilities to respond to those incentives. Some people in our country think you just change the financial incentives, go to capitation, bundled payments, etc., and people will respond. The point is, they don't just respond when you have centuries in which they've developed other kinds of capabilities other than integrated care, and when you think also that they're on the other side of getting their income from working in a fragmented care system. Third, the importance of teams. Okay, the importance of teams, and the most important person on the team is who? The patient, absolutely. But that's very glib to say that. But what does it really mean to involve the patient in their care? The fourth thing is the importance of information management. Electronic health records, absolutely. And the fifth point, change management. Okay, I heard or I read somewhere an old Japanese proverb. Goes along the lines that vision of what you want to accomplish and exciting people and getting them motivated out there without action and implementation and being smart on how to do that is simply a daydream. But you flip that around, taking a lot of action, throwing stuff out there, right, without the vision of what you're trying to create and exciting people about that is a nightmare. So we have in our legislation these accountable care organizations in our country, and it's causing us to re-examine these 3 questions when you unpack that term. What does it mean to be accountable in the 21st century? Accountable to whom? Who are the stakeholders? What are you accountable for and how? What does it mean to provide care in the 21st century when we have these smartphones, all kinds of health applications, at-home, in-home monitoring? And what does it mean to be an organization? Virtual organizations perhaps are going to come more to the forefront, networks as well. In all of our countries, we express in our country as the triple aim: improve quality, the patient experience, improve population health, and reduce the cost growth. In our country, we had a number of organizations trying to do that hard work without the supportive payment and regulatory environment. And that is what's now changing in the United States. If you're running a hospital now, the business model is not to maximize that inpatient margin. That's the current model, right? You discharge, it's somebody else's responsibility. But if you're now under a global budget or a bundled payment for cabbages or hips or knee replacements, you have to really work with the whole continuum of care, all the doctors and nurses, to manage that patient well, not to have the readmission, because if you do, it's money out of your pocket. Okay, I'm going to pause on this a bit and challenge you. How many of you are in the process of making these mistakes? If what you're doing is going to happen, certainly in the United States, you will overestimate in the GP commissioning the ability to manage patient care risk. You will overestimate the ability to implement electronic health records. The third point is how to manage the data, not just, you got it and so forth, just a bunch of random kinds of data. How do you turn it into information and information into knowledge? Overestimate your ability to standardize and improve care, to balance the interests, in our country at least, of the specialists in your country, the GPs, the nurses, the social workers, the patients, how you balance the interests. Insufficiently taking seriously that the patient is the most important member of the team. The failure to manage the contractual relationships to navigate the legal environment, and the failure to integrate care beyond the structural level. And probably in the race to the bottom here, it's the failure to recognize the interdependency of all those other mistakes. If you just think about that, they kind of accumulate, right? So you're going to make mistakes, that's fine, but learn from them quickly. Prevent them where you can. Here's a high-level way of bringing some of this together, I think, in countries throughout the world. You need a foundation of leadership and empowerment, politically, in NHS, in all the regions, and so forth. You need governance and management. You need some resources to do this stuff. It can be a very heavy lift, as you know. But it's this balance. Yeah, you got to have the incentives, but you also have to have the capabilities, and you have to have the transparency and the accountability to get the feedback. If you get that balance, then you can develop these effective, what we're beginning to call accountable care organizations. Healthier lives in a safer world is what we're all trying to achieve. That happens to be the Campanile on the Berkeley campus. Thank you very much.